Okay. So for the next thing which we'll be talking about, next infection, sexually transmitted infection. This is what is known as gonorrhea. So we are talking about gonorrhea infection. Of course, gonorrhea can affect mostly the genitals. If you practice oral sex, it can also affect the mouth and all of that. Do you understand? But I couldn't actually bring videos showing all those genitals because they can now target sexual content. Do you understand? So gonorrhea is a sexually transmitted infection. It's caused by a bacteria known as what? Neisseria gonorrhoeae. So it's often referred to as a clap. So it's especially common among people that are aged 15 to 24. Okay, so like chlamydia, it can be sneaky. Most people don't show symptoms. Do you understand? Till maybe the thing spreads extensively, they just see symptoms from nowhere. So how does it spread? Maybe people practice vaginal sex, anal sex, oral sex, right? Usually with an infected person. So from mother to baby through childbirth, where you are sharing sex toys without proper cleaning or protection. So what are the different symptoms you can watch out for? So many people, they show no symptoms, but if symptoms is appearing, in women, they can be having vaginal discharge if their urinating is painful and they are bleeding even when it's not their period, pelvic pains. In men, you can be having some discharge from the penis, swollen or painful testicles. So other areas, if you have it infection in the mouth, for people that practice oral sex, have a sore throat. Anal itching, that's for people that practice anal sex. All right, eye redness and pus if it's transmitted to the eye. Okay, all right, for men, the ejaculate on the face of women and all of that. So diagnosis is urine tests or swabs from affected areas, often tested alongside other STIs like chlamydia and HIV. So treatment, typically treated with antibiotics such as things like Ceftriaxone. Okay, then your partners should be treated simultaneously. Do you understand? Because they can treat you, and when they are done, your partner can still reinfect you. So I think that's just it. They avoid sex toys for 7 days after completing treatment. So just so you know that there could be complications coming up if you don't give proper attention to gonorrhea infections. So they can cause pelvic inflammatory disease, okay, then epididymitis in men, disseminated gonococcal infection, bacterial spread to joints, increased risk of HIV transmission, eye infections or blindness in newborns. That's when the mother transmits it to them.